10 things to know about Medicare Advantage. 1. You must continue to pay your Medicare Part B premium. Medicare then gives your premium to your insurance company Medicare Advantage plan to help pay for your additional coverage. 2. Medicare Advantage has you covered. Medicare Advantage plans must cover all the services that original Medicare covers and may offer additional benefits. Important: hospice care is still covered under original Medicare. 3. Joining a Medicare Advantage plan may affect your current coverage. If you have existing coverage or employer-provided health insurance and plan to work past 65, check to see how joining a Medicare Advantage plan could affect or cancel your current coverage. 4. It's best to use network providers. Use of network healthcare and pharmacy providers is typically required. Using providers outside of the network may cost you more. In an emergency, you can use any provider. 5. You may qualify for financial assistance. Depending on your financial situation, you may qualify for help paying your plan premiums or Part D medications through a low-income subsidy or extra help. 6. If you enroll in Part D late, you may pay a penalty. This is an additional amount charged by Medicare that will be added to your Part D premium. If you go without Part D coverage for longer than 63 days in a row after your initial enrollment period, Medicare Advantage plans that include Part D coverage meet Medicare coverage requirements. 7. A Medicare Supplement Insurance Plan (Medigap) policy is not a Medicare Advantage plan. Medicare supplement plans are health insurance policies and are secondary to original Medicare. Medicare Advantage plans combine original Medicare Parts A and B, and often Part D, into a single plan. 8. Keep your member ID card handy. Members must present their insurance healthcare member ID card, not their original Medicare card, when receiving services. 9. Medicare Advantage offers the same protections as original Medicare. Even though Medicare Advantage plans are privately administered, you still have the same rights and protections as with original Medicare. 10. You have a built-in financial safety net. Your plan's annual out-of-pocket maximum is your safety net that ensures you'll never pay more than a certain amount out of pocket in a given plan year for covered medical services. Prescription drug coverage. Medicare drug coverage helps pay for prescription drugs you need. Even if you don't take prescription drugs now, you should consider getting Medicare drug coverage. Medicare drug coverage is optional and is offered to everyone with Medicare. If you decide not to get it when you're first eligible, and you don't have other creditable prescription drug coverage like drug coverage from an employer or union, or get extra help. Generally, if you're a late enrollee, you have to add a late enrollment penalty. You'll pay this penalty for as long as you have Medicare drug coverage. The difference between total drug costs and out-of-pocket costs. Total drug costs is what you pay for prescription drugs each year, plus what your plan pays. Does not include your monthly plan premium. While out-of-pocket costs, the total amount you pay for prescription drugs, including your deductible and any discounts paid by drug manufacturers while you are in the donut hole, does not include what the plan pays or your monthly plan premium. Prescription drug coverage defined. Pharmacy network. Some of the large insurance companies we work with can have more than 65,000 network pharmacies across the country. To receive benefits, you must use an in-network pharmacy and show your insurance company healthcare member ID card, not your Medicare card. You may receive additional savings on your prescriptions by using a preferred retail pharmacy, or by using the mail service pharmacy and having your medications delivered to your mailbox. Drug list formulary. A formulary is a list of the drugs that a plan covers. Each plan has its own drug list. Tiered formulary. Many plans use tiered formularies to group covered drugs according to cost. It defines the following tier. On the first tiers it consists of preferred generics. Tier 2 is for generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs. And lastly the Tier 5 is for specialty drugs. Step therapy. One way we use insurance companies to help you save money on your prescriptions. is by offering lower-cost drugs that can treat the same medical condition as your current brand-name drugs. You may be asked to try one or more of these lower-cost drugs before the plan will cover the brand-name drug you are currently taking. Quantity limits. Some drugs have quantity limits, where the plan will cover only a certain amount of a drug for one copay or over a certain number of days. The limits may be in place to ensure safe and effective use of the drug. If your doctor prescribes more or thinks the limit is not right for your situation, you and your doctor can ask the plan to cover the additional quantity. Prior authorization. Before the plan will cover certain drugs, it may need more information from your doctor to make sure the drug is being used correctly for a medical condition covered by Medicare. You may be required to try a different drug before the plan will cover the prescribed drug. Asking for an exception. If you need a drug that's not currently covered by your plan, you may ask the plan to cover your drug even if it is not on the drug list. This is known as a formulary exception. Ask to waive coverage restrictions or limits on your drug. This is known as a utilization exception. Coverage decisions. If your doctor has submitted an exception request on your behalf, generally the plan will make a decision within 72 hours. You can request an expedited, or fast, decision if you or your doctor believes your health requires it.